Hi, everyone. It's March 3rd, 2025. Welcome to Talk Back. And I'm so happy to be continuing my series of shows about senior resources, agency on aging, and all the wonderful programs they do for our senior community here in Eastern Connecticut. I've done shows on food. I've done shows on so many of their programs. We did a program with Allison Zvorjak, who was the director of the agency, and she gave us a tour of so many things that I wasn't even aware of as a fairly educated person. So I'm wondering about how many people are out there in the shadows, seniors specifically, and their families, who don't know what there is to offer. So let's educate the public and do as much outreach as we can, starting with talking to two more people from Senior Resources who work on very important programs. So I'm very happy to introduce Joan Marshall. Hi, Joan.
Hi.
Joan is the Director of Care Coordination at Senior Resources, right?
Yep.
And Robin Brewer, who is the Respite Program Coordinator.
Hi.
Hi. So today we're going to be talking about caregiving. So let's talk about our general culture here in America. Why do we need to have family members and friends, people who have full lives and everything else, be caregivers? Why doesn't our culture, our state and national governments provide more support services for our seniors? And why do we need you guys to fill in for that? So you start.
So I think sort of the assumption is that everyone has a caregiver. I think that's how our medical system functions. That's how our social system functions, that if you are unable to do something, you have a family member or a friend who's willing and able and available to help you. And I think one of the things that we do is help those informal caregivers who end up, sort of in that position, sometimes unintentionally, to find support to give them help in what they're doing to support another person.
Okay. So my mother had Alzheimer's before she died, and she lived in my home. We did have some care that we brought into the home, but our medical team said to me and my husband and my brother, you need help. Number one, you can't be a caregiver unless you yourself are cared for, and you need to take a break. You need a respite, otherwise you're going to get as sick as the person that you're caring for. So give us your thoughts on that, Robin.
Well, that is true. In order to take care of someone else, you sort of need to keep your cup full. So some of the programs that we offer are designed to do just that. They're meant to give an informal caregiver, so by informal, you're not being paid, and they're meant to give you a little bit of a break so that you can fill your cup.
Okay. So am I right that there's a lot more that our state programs, local and federal programs, can do to help the people that need help, so the caregivers don't have to be duplicating their lives and adding much more work and much more responsibilities to their already busy lives? What do you think?
So there are both state and federal programs that provide caregiver support. So some of the federal programs are available in every state in the country. Different states implement them differently depending on their geography and their populations. And then the state of Connecticut has some programs that are unique to Connecticut that also support caregivers.
Okay, we'll get into those, but let's talk about number one, Robin. Who are the caregivers? Who are they? Give me the categories of caregivers.
There could be parents taking care of special needs children. There could be full-time working individuals who have a family of their own, yet they're supporting their parents. It could be anyone. A caregiver could be someone you meet at the grocery store. You just don't know what their scenario is. But I think you could make an argument that everyone is a caregiver on some level.
On some level.
Yeah. And I think a lot of spouses are also caregivers, sometimes short-term, sometimes long-term. And children frequently are caregivers for their parents, again, in varying levels. Sometimes it's for a weekend because mom has cataract surgery and needs help putting drops in her eyes. Sometimes it's long-term, like what you described, where someone has an Alzheimer's diagnosis and they need a lot of support and a lot of care on an ongoing basis.
Now, I think, Joan, you sent some information about how much money we're annually spending or that caregivers are providing. Can you
it's huge.
Can you talk about that?
So caregivers provide a lot of unpaid labor. Right. And I think if we looked at the cost of that in terms of what it would cost if we were to pay someone to do those jobs, and also what it costs the rest of the community in terms of missed time from work or inability to
Right.
do your job well, and miss time at other things. So if you're an adult caring for a parent, you may then be paying for childcare because you're trying to care for your parent and having to pay someone to take care of your child during certain times.
Right.
So it's expensive.
Okay, so the information you sent me said that the AARP research attaches $18.43 value to the estimated 390 million hours of unpaid care that family caregivers provided in 2021, not
Yep.
that long ago. And in Connecticut, there are 420,000 caregivers. So
Yes.
we have a population of about 3.5 million. So that's a lot of that's a lot of caregivers.
Yes,
About-
and I think those are people who identified themselves as caregivers. What we find is that people frequently don't think of themselves as caregivers. When we tell someone we have a caregiver respite program, oh well, I'm not a caregiver. I'm just a spouse. I'm just the wife.
Right,
I'm just the daughter. But so that number is probably lower than
Right.
the true number of people providing care.
And the value of those services of care, those unpaid caregiver services, is valued at $7.2 billion a
Yep.
year. Wow. Yep. And this is a $1.27 billion increase since the last report was released back in 2019. So the problem is gaining as the senior population is living longer, and then as toward end of life there are more and more issues, but still life goes on because we have so many medical advances, right?
Right.
This creates the issue. So what else can you tell us about the 420,000 caregivers in Connecticut? Do they all know about the access to services that you provide?
No.
That's the problem.
That would be nice. I think that would be great for them, and certainly it would be beneficial to us. No, I think that's one of the things that we do a lot of, is fielding phone calls from people who don't know what to do.
How do they even get your number? How do they know Senior Resources number to call? What's the referral thing? Is it through the hospital, the doctor, the social worker,
all of the
the
above.
neighbor?
I think things like this, getting some outreach, getting the word out there helps. We do additional outreach at events, so we try to get our name out that way. We have support groups. We work with the Alzheimer's Association. But I don't know how people get our phone number. I think that's why this kind of outreach is great.
It's very important because as I keep thinking, because I know, as I said, working in the field of domestic violence, we know that there are still, we don't know how many people in the shadows who are being affected,
Right.
but don't know where to go for services or are too afraid.
Right.
Just don't have the resources to do anything about it. And the same thing for all the caregivers out there who, and I have found doing programs on elder law and elder abuse, sometimes the caregivers, without meaning it, trying to do the right thing, are almost abusing. Caregivers can get frustrated, burned out,
Right.
and maybe do things that are actually harmful to the people they're trying to protect.
Right.
Right.
Which is what I think our programs are intended to reduce that stress level and try to address some of those things.
Okay. So we mentioned if spouses, children, neighbors, friends, but I want you to talk specifically about grandparents, because I know in our nation there are millions of grandparents who are not just caregiving but raising children. Does that count as part of the caregiving population?
Yes, absolutely.
So talk about that, Robin.
Okay, so if part of the National Family Caregiver Support Program, which is a federal program that we have, like Joan said, it's It's administered in all the states, although it may be implemented differently. But here in Connecticut, well, through Senior Resources, there is sort of like 3 facets to the National Family Caregiver Support Program, and one is grandparents raising grandchildren. So the stipulation is that the grandparent has to be 55 years or older, and if they are raising their grandchildren, there are some monies we have that can support them, and it can support them for enrichment activities for the grandchildren. It could support
What's an enrichment activity?
an after-school activity, football, soccer, summer camp.
Summer camps.
Activities that the child can sort of prosper in, but the grandparent may not have the money to support that. So our program could do something like that. Karate lessons.
Equipment too. Like if a child wants to play soccer and they need cleats and shin guards and whatnot, the program can help pay for those kinds of things.
Correct.
Clothing needs,
Yes,
health,
clothing needs.
glasses, dental care.
Yes.
Are there support groups with grandparents?
There are support groups for grandparents
So
raising
right here in
grandchildren.
Eastern Connecticut, where are the support groups for grandparents?
Right here in Norwich, at the Rose City Senior Center.
Okay.
Our coworker, Lori Rogalski, oversees the support group program.
And how often does something like
Once a
that
month.
meet? Once a month.
She also runs one in Putnam,
Putnam,
I
yep.
believe, possibly Warregan, and I believe there may be one in Plainfield.
The information is on our website
Now-
about where the support groups are.
One of the eye-opening things for me, learning about all the senior resources programs, was not all of them are income-based. You don't have to have means to participate in some of the programs. So what about the grandparents programs?
Those with the greater financial need do get priority. I mean, our funding is limited, and that is, it's not the only item that we look at, but it is a consideration with limited funding. The other thing I just wanted to mention, one of the items that we can support is big, like life-changing events, like a prom or something like that. This money can be used for that if the
For the kids,
grandparents can't
obviously.
afford it.
Yeah.
Yep.
Okay.
And we can provide information and assistance to people regardless of financial situation. So a grandparent might call and we would decide that, you know, they do have the financial means to pay for some of the things themselves, but we can help point them in the right direction, maybe to a support group, maybe to other resources that could benefit them or their grandchildren. And they don't have to be technically grandchildren. It can be an older adult raising a youth under 18.
Oh, okay.
They don't
Correct, or
have
kin-
to be related. It's kin
Kin
But
raising
the
kin.
older adult has to be 50, at least 55 years old.
Yes.
Yeah.
Yeah.
That
So
program has also been expanded recently to include someone. So typically the program ends when the child turns 19, but if the child has special needs and has been raised by that person
and continues
since
to
birth
be
up.
cared for in the
Correct.
home long term,
Yes.
then it's still part of the program.
Correct.
Otherwise, it ends when the kid turns 19.
Correct,
Right.
Yeah.
which is a little bit more
So
than
of
most
the
other programs.
400, so does the numbers strike a positive chord with you that there's over 400,000 caregivers in Connecticut?
Oh, absolutely.
And do you have any sense of, and we have a smaller population area here in Eastern Connecticut, right? Do you have any idea how many people you're serving?
Oh,
I think there's about
approximately?
45 grandparents on the program currently, and I think there's about 130 caregivers on the program. That was
that's National Family.
Yeah.
So,
National Family. Yeah,
and with our other programs, I would say,
John has about 100.
yeah, I mean, I would give a ballpark of probably close to 500 a year that we provide support to in some capacity. Again, a lot of it's sort of shifting because we also help people access other programs. So someone might be on one of our programs for a short period of
Right.
time and then move on to another
Okay.
better funded program.
So of course, all of these programs to help people, they depend on funding of some type. So talk about that. Is it federal and state, local, donations? Senior Resources is a private
Private, not-for-profit.
nonprofit
Right.
agency. So talk about that. Obviously, you can't do a program unless you have the funding source.
So the National Family Caregiver Support Program is federally funded. All of the funding for our programs comes through the Bureau of Aging, which is part of the Aging and Disabilities. So all of our funding comes through them. The family caregiver funding is federal. The statewide respite care program is state funded. We have the Congregate Housing Support Program, which is HUD funded. So it's
Different
sort of
funding
mix and match.
sources.
Yep.
All
Yep.
right. But you're dependent on making sure those funds come through.
Correct.
Now, I don't want to get into political discussion, but just right now, today, a lot of agencies around the country are waiting to see what the status is of going to be the federal share of support and how that's going to affect all their programs and their jobs and so forth. So that's something you're all concerned about right now, I gather.
And we watch pretty closely to see what's happening in terms of funding streams and legislation and that sort of thing. So we keep an eye on all of that.
All right. So do you have an opinion about what the greatest need is for caregivers? Is the greatest need to get counseling to revive their spirits and support, or financial aid? What is the thing that's most important to keep a caregiver on board and to make sure that they're not hurting the person they're taking care of? What do you think?
Respite, a little bit of time to themselves. And some of the ways that we offer that are the program could fund some adult day services. So if the person is a candidate for an adult day program, we would encourage them.
So let's talk about, so right now we're talking to you, Robin, as the head of the respite care program, right?
Yes.
So give us all the different ways. You're talking about adult daycare. How does that work? What if the person being cared for has to qualify, right? Not every program would accept them. How does that work?
Correct. Well, we each time we receive an application, and there's an application process for the program, we go out and we assess the situation. We speak with the caregiver, we meet the care recipient.
What programs might work for them?
Correct. And if we determine, or the caregiver determines that no, my mom isn't very social, we don't want to do an adult day program, we wouldn't ever push that. We contract with agencies where we could have someone from a home care agency come to the home to be with the individual so that the caregiver could leave to have a little bit of a break for themselves.
So what are some of the other things that the respite program does?
Sometimes a short-term stay in a nursing home, so it's short-term inpatient stay. If the caregiver needs to go away, or would like to go on vacation, there are times when we could fund a short stay in a facility.
Doesn't it have to, aren't there rules about how and when, specific rules about how and when you can go into a nursing
It's
home?
a non-medical inpatient stay.
Oh, it's a non-medical thing.
We're providing respite.
And
it's a respite stay.
The nursing home will accept that, so long as the funding is there for it.
Correct.
Right.
Correct.
Okay, what else?
In-home services, adult day programs. There is an opportunity for the caregiver to hire a person of their own choosing to come in to stay with the individual. So for example, if your cousin would provide the care and you feel comfortable, and the person that you are caring for would feel comfortable, we can arrange for that to happen.
And that person coming in would be paid by their agency.
Through the grant, correct.
Now, when my mother was alive, we had someone come in, I think it was someone who volunteered her services to be like a friend for the day.
The friendly visitor?
Picked my mother up, took her out for an afternoon, brought her back. I don't think she was paid for that. Are there volunteers who do that work?
I don't know that if there are any more. There used to be a program. I've not heard of that.
So right now, if you wanted something like that, it would have to be a paid program.
Pretty much.
That you would have to fund. All right. And people are taking advantage of all of these different programs?
Yes.
Anything else under the respite program?
No, I think I can just double check my notes, but I think that's it. Inpatient.
That seems covered. All right. So Joan, let's talk about some of the other programs that you have under the umbrella of caregiving.
So the Congregate Housing Support Program is functioning in 9 different housing sites in Eastern Connecticut. And that program is HUD funded. That program will pay for in-home services and some additional things like foot care for individuals who live in those housing sites.
So what makes congregate care, what does that really mean? Just people living in senior communities? Okay.
Yep. So there are 9 specific communities in Eastern Connecticut where that funding is available. There's a resident services coordinator who would meet with the family, help figure out what services would be appropriate, and that program does have a copay. I believe it's 25% now. So the individual pays a portion of the cost of their services. But again, if I'm a caregiver and my parents live in one of those communities, that could be a really great resource to help get some extra help coming in for my parents and take some of the burden off of me
So,
trying
so,
to be there
so
every day.
in this case, your parents don't have to be living with you, getting caregiver
Correct.
services from you. You can get caregiver help from them when they're living in a senior community too.
Correct. Yep.
Yeah.
And they don't really need a caregiver for this program.
No, they don't. I mean, it can be a support to a caregiver, but people living in those housing sites can get support even if they don't have a caregiver of any kind.
So, how do people in those congregate properties learn about this?
I believe that the program is advertised in most of the community centers, the community spaces at those housing sites. And when people apply for housing there, they're given the information.
Okay. And what outreach do you two do in terms of programs, seminars, information? Where do you go? What do you do to get the word out for what you're doing?
So Senior Resources sponsors multidisciplinary team meetings once a month, and we meet with other professionals in the community to talk about programs and services and challenges. So we participate in those to make sure that other professionals know about our programs. We host expos, so we get providers together at one location. Last year, ours was at Dodd Stadium, and we had, I don't know, probably 100 different providers that come in, and seniors then come there and meet all the providers, and we're there giving information about our programs, and it's a good opportunity to meet other professionals.
Is it going to be in
as well.
one this year?
I believe so.
Oh.
I don't think we have the details quite yet,
Okay.
though.
Do you give out and make speeches at senior centers or other places?
Yep, we do. We sort of have our Senior Resources 101 presentation that covers all the programs and supports that we offer. And we do go out with that to different senior centers, community centers, libraries, whatever.
Okay. What about
We speak
you?
at support groups, health fairs, wherever we learn that there's something that perhaps we could kind of attend and get the word
Get the
out.
word out.
And
Yeah.
spread the word. Okay, so then what are some of these other programs? ADC, PERS, SNF. Tell me about
The
all
alphabet
all
soup.
these alphabets you
Yes,
gave me.
yes.
I want to know how they help.
So ADC, we just spoke about, that's Adult Day Program.
Right.
You had asked about ways that we provide respite. The PERS is another way. It's a personal emergency response system. Actually, we were talking about that ahead of time. It's the lifeline button, the I've fallen and I can't get up button. Sometimes that's all someone needs, because if a caregiver feels their parent is a fall risk, or the parent has had some falls, and this is an extra level of security, so if the care recipient falls,
that's
there's a
what
way
that
for
is.
help.
Okay.
We could provide that.
All right.
But Apple Watches have taken the place of those.
And
They're more
SNF,
sophisticated,
skilled nursing facility. That's
Yep.
what
the
that is.
inpatient temporary stay.
Oh,
that we
this is
talked
part
about.
of the thing. Okay.
Yep.
And then you were talking, Joan, about RCP, Respite Care Program. We talked about
The
that.
statewide respite care
And
program.
then the NFCSP, National Family Caregiver Support Program. Why don't you just mention that again? I know you were talking about that.
So
Joan.
that's the one that Robin was talking about that has the 3 components.
Oh, the 3 components.
So
okay.
in-home respite, if a person needs help in the home. The grandparent support program is the other facet. And then the third facet to that program, we call it supplemental. And basically it can fund items for which there is no other funding source. So for example, if a person needs a modified bath seat, we could use supplemental monies to pay for that. If they need a ramp, we could use our supplemental funding toward the cost of a ramp. So bathroom modifications. The PERS that you talked about comes out of this bucket of money. I'm trying to think, we've funded some tub cutouts so that someone has easier access in and out of the tub.
Of a tub shower, yeah.
Okay. And so, Joan, you also sent me CHCPE, Connecticut Home Care Program for Elders.
So that program is funded through the Department of Social Services, and it functions statewide in Connecticut. It allows people who qualify. There are income and asset guidelines for that program, but it allows people to get quite a lot of support at home in terms of in-home support, adult day, the emergency response. And that program is managed by access agencies across the state. In Eastern Connecticut, it's primarily Connecticut Community Care, and then in other parts of the state, it's some of the agencies on aging.
Okay.
So you don't need a caregiver for
But
this.
there are income and asset guidelines for that program.
Right, and that's a
Yes,
standalone program. You don't need a caregiver, but again, it's one of the ways that a caregiver can find support for
Yeah,
their
got it.
loved one.
And then talk about, Joan, you say there are programs, VA, VDC, programs for veterans. How does that work?
So the area agencies on aging support the Veterans Directed Care Program, and Robin is the point person for that program as well. So I'll let her take over that one.
So if a veteran has needs assistance in activities of daily living, whether they're service connected or not, they can contact their local primary care physician through the VA. And there's a program called the Veteran Directed Care Program. So the VA qualifies them, but essentially, if they qualify, they would be given a budget where they could hire someone of their own choosing. You don't typically go through an agency to receive the care, the help with the personal care. You hire your own people, and then I would help the veterans to manage their money, manage their staff, find staff, stay within budget, and basically stay home longer.
So are there a lot of veterans in Connecticut taking advantage of this program?
I think over the last year, the program has gone through 10 or 20 statewide to, I believe there are over 60 veterans statewide now.
Okay. And there's probably more, because I think we all seem to understand that a lot of veterans are still out there in what I call the shadows.
Yep.
And veterans still can receive care through an agency. This isn't stopping that from happening, but if the veterans are not happy with the care through an agency, then they can opt to self-direct. So the veteran or their representative would need to be able to self-direct.
So they can still access all the other programs if they're eligible for those. Okay, great. And then, Joan, you were talking about how people pay for all of these things, right? So talk about long-term care insurance. Isn't it expensive and it's formidable for most people to be able to afford that? And what happens if you don't have that? Talk about that.
So long-term care insurance is a really great benefit. I think if people access it when they're younger, it's less expensive, and you
gotta
kind
start
of
really young.
You need to start young, and I think it's kind of hard when you're in your 20s to think about needing long-term care at the end of your life.
Right.
But if you try to apply for it when you're 50 or 60, it is quite expensive.
Yes.
So it's good to start that process ahead of time. Long-term care insurance can pay for in-home help and can also pay for inpatient care. So someone who needs long-term care in a nursing home can use their long-term care policy to cover those costs. It really is a great benefit. I think for the most part, if someone needs long-term care, either at home or in a facility, the options are to qualify for a program like the ones we've been talking about, to have long-term care insurance, or to pay privately using your income or your savings to pay for the care that you need.
Yeah, so private pay is very formidable, obviously, right?
Care is expensive, yes. There's no doubt about that. Sometimes I think it's a great option for people who can afford it. If you are paying privately, you can customize your services better than if you're going through a program, but it is very expensive.
So are there advisors? Who would you go to? So I've got money and I want a private pay, and I'm a caregiver. Where do you go to get advice as to what resources to use and to utilize?
So we provide limited information to people. We can help them figure out what agencies would cover the town that they live in, what facilities are nearby, whether there's an adult day program, that sort of thing. If people are trying to plan for potentially qualifying for Medicaid or another program down the road, we would advise them to talk to an attorney. And there are some agencies that do provide case management on an ongoing basis to help families navigate that interaction between purchasing care and making it work for someone.
So yeah, you just touched on something, the legal aspects of the financial aspects. So when you're a caregiver, you're not just in charge of taking care of the health of that person, but you may be in charge of their bank accounts, of their assets, of their property. What kind of will do they have? What's going to happen in the event of this? What happens with their illness? And do they have health proxies?
And power of attorney and all the legal.
So what efforts does Senior Resources have to help people with that in the caregiving community?
it's one of the things we talk to people about, certainly at any kind of assessment visit, whether they've made some of those arrangements. Is there a power of attorney in place? Do they have a healthcare proxy? And
Prepaid burial.
prepaid burials, all of those kinds of things. And if someone needs help with that, we would refer them to an attorney.
Yeah.
I mean, we don't provide legal advice.
Well, they all need help with it. The point is that I'm making is that some people may not realize.
Right.
When you're a caregiver, there's a lot more than just the physical care of that person.
Yes.
There's so many
There
aspects
are
of
a
their
lot of
lives that they
aspects.
need help with, and it requires other agencies and other professionals to do that.
Yep.
And many people are not aware of that.
Yes, that is true.
So,
It's complicated.
and what happens is when the emergency comes, when the thing at the hospital comes,
Right.
when a decision has to be made, that's when they go, oh my God, we don't have the paperwork, we
Right.
don't have what we need. And
Right.
that needs to be remedied.
Right.
So with all the things that we're talking about, what is your philosophy about caregiving in our society, and what role should our social services play? Should we be doing more for people so they don't need their children and their loved ones to take care of them? Should we have better daycare services when we have daycare for kids, and that's too expensive too. It
Right,
needs to be changed.
right.
Should we have national daycare program for seniors? I don't know. I'm
Nice
just
if we
saying.
had more
What's the
adult day
philosophy about
services
how to,
in our area. We don't have a lot.
What?
No, we don't.
We have a lot of areas of the state, even eastern Connecticut, that are uncovered.
So I guess my question is, what are your thoughts about how to make the whole system better, more accessible, giving more aid? If you had your druthers and you were running this whole thing, what would you do?
I think there's two parts of it, personally. I think that all of us, with families, with friends, with people we care about, need to have some of those conversations earlier. What would you want? How do you envision living out the end of your life? Would you want to be home? Kind of getting a better sense of what people are comfortable with and how they would want things to happen. Because you're right, in an emergency, then you're suddenly trying to make decisions and you may or may not have that information. So having some of those conversations and making it easier, making it more popular, I guess, to have those conversations.
Well,
Less
Americans, we don't want
Less
to talk. We don't
uncomfortable.
want to talk about end of life in America.
No, we don't. And I think that we do ourselves a big disservice. I also think that looking at what the needs are out there in terms of supporting individuals and their caregivers, a better workforce is huge. I think that it's hard to find staff in home care agencies, in nursing homes, in hospitals, in any setting that's providing care. And I think as there are more people needing care, more staff are needed, and those people just aren't out there.
Are those professions paying enough money, getting enough respect? Why does somebody want to go through an education for that if they're not going to be able to join a profession that gets the pay and respect they deserve?
Exactly. And I don't know how we change that either. I think pay is important, and I think some of those things are changing, especially in Connecticut. The minimum wage is going up. The state of Connecticut is looking at the reimbursement rates that they pay for those services. But no, I think it is. It's hard to recruit people to a profession that isn't seen as somewhere really great to work. So
Right. And so the other question I was asking, a more philosophical question, is what is society's role? And right now we have this system where we have a little help from the federal government and the states, but we're mostly having to work with nonprofits and our own private. And I guess I'm just throwing out, we don't have to answer it now. What's the role of society? Should our government, all of us paying our taxes, go more for taking care of the senior community without needing all these special programs that are a little bit, and leaving so many people out?
that would be nice.
That's a good, so
That
your
would be
thoughts
nice.
on that,
I
Robin?
think that would be a wonderful thing. It seems like we're always, as caregivers and as people needing help, we're always trying to, scramble to try to find a way to meet the needs, and we struggle.
Yeah.
We struggle with staff. We struggle with rates. We struggle with finding time of day care. It's
Right.
hard to name the time frame for which you need care because that may not always be provided. For example, overnights. Sometimes caregivers say, if I could just sleep 1 or 2 nights a week, it would really help me. Well, that's a difficult.
Time to staff.
Yeah.
Yeah.
Right. Right. So what I also like to do is, do you have any personal stories? In other words, people that you've helped through some of these programs. You have an anecdote about it, or somebody who was grateful or not grateful or benefited from your program? Do you have anything? I know I didn't
We
give you a
get
chance
surveys.
to
Yeah, no.
think about that.
I
but
can think of one individual. They used the respite hours that they were given to have an inpatient stay. So they opted, instead of one long stay, they were able to work out with the nursing home for long weekends. So they've been able to get away for a long weekend a few times instead of having one long stay. So it's helped them build, the husband and wife build their relationship without having the mom.
And they were
there.
able to craft a program, an unorthodox program, but
And
they
make it
got the
work for
help.
them.
That's good. Do you have anything?
I'm thinking of a family where the mom had Alzheimer's and was needing supervision during the day, and they were able to connect her with a program that would pay for adult day, Monday through Friday. And although there aren't very many programs, one of them was en route for the daughter from home to her job. So she was able to drop her mom off and then pick her up at the end of the day, and the home care program was able to pay for the daycare. So it meant she could keep working, mom could stay living at home,
Right.
and it worked.
So you get a lot of satisfaction, gratification that people are accessing these services, and it's making a difference in their lives, right?
Absolutely.
Absolutely.
It's adding quality to their lives.
And if someone comes in through our program, we sort of fact find, and if there's another program where they could get more benefits from, we certainly can help bridge the gap and get them over to the other program so that they can get
I'm thinking
receive
there's
as
got to
many
be
services.
some main clearinghouse where you're forced to go when you turn a certain age, where you have to sit
here
down
and
and
think
say,
about
these
it."
are all, I'm the counselor that will tell you about all the programs that you can access that are specific to your needs. Where is that?
So people, well, I think the one point that everyone comes to is applying for Medicare.
Right.
So that is a really good time to provide education. That's one of the things that the agencies on aging do, because we help people who are new to Medicare
Right.
figure out how to access those
Right.
benefits. So that's a time we can give them other information. But again, you might turn 65 and you're not caring for anyone
I don't
yet.
need any help.
I don't need
right.
any help, exactly. And I don't think people really retain information when it's not relevant. So at 65, someone may be given all this information, but then 10 years down the road, they are now, caring for someone with a dementia diagnosis, and they're not putting the piece together that they could go back to the agency on aging. So I think that's where getting the information out about what we do. And
one of the things is, I'm wondering if the doctors caring for these people, or even the hospitals caring for these people, are using their clout to give you information. I know the social workers in the hospitals are good. Sometimes I guess they are the main source for providing this information as you leave the hospital. But sometimes our physicians,
we do get information from physicians.
I don't think our physicians are giving out. They should have senior resources pamphlets in their waiting rooms. Do they?
Sometimes they do.
Sometimes they do. Okay.
And I think as we're working more with healthcare organizations, Hartford Healthcare, Yale New Haven, they have care managers in their system who help people who are in a predicament of some sort. And so we get referrals through those individuals as well.
Okay.
So that is helpful.
Okay. Have we covered all the programs?
Mm-hmm.
I think so.
Have we covered all the programs? Now, you say there is resources to help. Again, Aging Answers, get support from Aging CT, 4 options for our aging community. Talk about that.
So Aging Answers is one of the things that the area agencies on aging in Connecticut are trying to provide answers to anyone about aging questions. So I think at every agency on aging, you can call and just have a question and someone will call you back, whether it's insurance, whether it's caregiving, whatever the dilemma may be. And what was the other thing? Oh, My Place CT. My Place CT is a great website that focuses on services and supports in Connecticut specifically. It has so much information, and it describes things in a really understandable way and links you back to the part of the state of Connecticut website that has an application
Okay.
or
So
eligibility.
not everybody has a website. Do we have a studio? Can we put a telephone number up on there before we end this program? Robin, give us a telephone number of Senior Resources.
860-887-3561.
860-887-3561, Senior Resources. It's a reminder we should put that up for all of our programs about Senior Resources. Some seniors don't have, even if they might have a computer, they don't know how to
That's
use
not
it.
where they're going to go to
Yeah.
look for information. Right.
Yeah.
And so we field a lot of phone calls from people. And
Is that the best number?
yes.
Yeah.
Yep.
Number.
Okay, that's the best number. Okay, so if we could put that up on the screen, 860-887
3561.
3561, that would be great. And then before we close, we do have some slides that we put together from
Right.
you.
So
Yeah.
we put together just a few slides with information about the programs that we oversee at Senior Resources.
Okay, so studio, can you put that up? All right, so why don't you talk about that,
Okay.
Joan?
Go ahead, Joan.
So this is the National Family Caregiver Support Program. This is what the brochure looks like. So
Okay.
if you see it out and about anywhere, that's what this brochure describes.
And you
it's
have to be 60 plus to get,
Unless
in
you're
general.
a grandparent or a
Right,
relative raising
right. Okay.
someone
Yeah.
of kin.
And that's the grandparents specific part
All
of
right,
the
let's
program.
stay
and it
on
kind
that.
of-
Let's stay on that just a little bit too, because I think that's an important one. And I like the idea that you really don't have means testing for this.
Correct.
So many things, the enrichment activities, school field trips, sports fees, sports equipment, educational classes, tutoring, mentoring, summer camps, clothing, supplies. I think that's all great. Eyeglasses, dental care, peer support, sharing experiences with others in the same situation, very important. So I think that's really a great program, because there's millions of grandparents in this country taking care of their kids,
And more every day.
and
yes.
more every
And
day.
not a lot of funding.
Okay, let's go on to the next slide. All right, talk about that one.
So that's the supplemental services part of the caregiver program that can pay for items. So those things on the list, durable medical equipment, air conditioners, ramps, incontinence supplies, things like nutrition supplements, Boost, Ensure, that sort of thing, wound care supplies. In general, items that are not covered by any other insurance or any other
Right.
funding source.
Right. Okay, next slide. That's your,
That's the
Robin,
Connecticut
that's-
statewide
yeah.
respite care program. It's a state-funded program. It has limited funding, so if you are caring for someone with an Alzheimer's diagnosis or a dementia diagnosis, the grant can fund things like adult day programs. We have companion and homemaking services. Those are getting more and more difficult to provide, but we can provide personal care attendance. Also the temporary inpatient stays, the nursing homes we were speaking about.
great. Okay, and the veterans program, Joan?
So this program can only be accessed through the VA. The VA sends us referrals. So if a veteran is interested in this program, they would need to reach out to their VA physician or care manager and ask to be referred.
Okay, but they also have the number here that is the Senior Resources number, 887-3561. We want to stress that number.
Yep.
For anybody who's listening, if you want more information, you can go online to Senior Resources, Agency on Aging in Connecticut. But if you want to call, 860-887-3561. And I hope people will hear that and maybe make the call.
I hope so,
and
too.
make the contact that way. So I hope when we put these programs out, studio, we can put that number on all of our Senior Resources programs. Okay? All right. I think there's one more now. I think, Joan, you asked us to add this information.
Right, the housing services program. So mostly the slide is important because it lists the 9 housing sites. They're all in Eastern Connecticut, so Willimantic, Plainfield, Putnam, Moosup, Brooklyn, and Danielson.
Okay.
So anyone in those housing sites can inquire
Yeah.
about the program.
a lot of people I know, foot care is a very big program
Yes,
because
and that's something that program can fund.
if you don't have insurance, which most insurance doesn't cover like nail cutting, things like that.
Right.
A lot of the centers have special programs for that you can. So here it is, 860-887-3561, Senior Resources Agency on Aging. Very, very
That's
good.
us.
So let's sum up. I want each of you to give me some closing thoughts about the importance of the work that you do, why people should access it, and what needs you see for the future, how that will go. Joan.
So I think what Robin said is true, that everyone is a caregiver in some capacity, and being a caregiver is hard. I think we have a lot of resources and supports to offer people, and if nothing else, we have information. So I think that we can really help people in those roles, whatever age group, whatever caregiving role they have.
Okay. And I think what you both are saying is take a look at yourself. You may be a caregiver and you don't realize
right.
it.
You don't identify that way,
right,
but yes,
right. That's
you
very
are a
important.
caregiver.
What are you doing helping your neighbor, your child, your elderly parent,
Right.
your elderly aunt, or somebody that you care about? Are you a caregiver? Yes.
Right.
Call Senior Resources.
Right.
They have a program for you.
Many times we hear, no, I'm not the caregiver. I just do the groceries and
Right. And help with medications and provide transportation.
So I think the sum of what you're saying is that we are all caregivers in one way or another. We can all use some help. Sometimes it's private help, personal help, but sometimes we can reach out to programs in the community. And the thing I think people have to realize is it's okay. It's not a shame to ask for help from the resources that the community has, or the state, or the local, or the federal government. They've provided these programs. You should take advantage of, and that's okay to do that. You don't have to feel too proud. I think some people might feel sometimes too proud to do that. I don't need that. I don't believe in that. I'll do this all on my own, right?
But it's stressful. It's hard. And I think even a little bit of help can go a long way.
Exactly. So, okay. Your final thoughts?
I think anybody who is caring for someone should identify themselves as a caregiver and certainly call, because even if you don't fit the criteria of any of the programs, still speaking with someone from Senior Resources, we can sort of identify other programs that you may be eligible for or sort of guide you, sort of use us as a roadmap.
All right, excellent. Okay, final idea, done?
Yep.
Okay, it was great to have Robin and Joan on as two other people who do wonderful work for Senior Resources Agency on Aging here in Eastern Connecticut on caregiving. As they said, you may not think it, you're a caregiver, get the help, call Senior Resources, 860-887-3561. Okay, it's great. We'll see you next time on Talkback. Bye.